Hello and welcome to the UWC School of Public Health video lecture series. I'm Dr. Gavin Reagon and I'll be taking you through this session on how to conduct and interpret a waiting time survey. So, if you want to do a waiting time survey, the first thing you want to know is what is it and what does it do? Well, obviously it measures waiting time. However, it also does several other things. So a key measurement is the service time, or this is the amount of time that patients would spend with the various staff members in a health facility. It also assesses all the services provided in the health facility, and therefore it can be used to determine how well a health facility is performing in various dimensions. Specifically, what a waiting time survey allows you to measure, and therefore affords you the opportunity to modify with a view to improving it, of course, is, first of all, the waiting times. So with the survey you will measure how long patients wait in a facility. Now, strange though this may seem, knowing how long patients wait in a facility is not that useful. Because in general you would know if patients wait for a short time, intermediate time, or a long time at a facility. Certainly the staff working at the facility would know that already, and the patients attending there would know that already. However, with the survey you measure the actual length of time. Once you know this, you don't know very much more than what you already knew to begin with. So if it is well known that you wait a long time at the facility, you will simply confirm that and give an actual time to that. So is it 90 minutes, 120 minutes, 150 minutes, 240 minutes, 300 minutes, whatever it might be. This is not that useful in that you've taken a qualitative measurement, i.e. you wait a long time at facility A, and you've now transformed it into a quantitative measurement. You wait 240 minutes on median at that facility. The more important thing is, if the waiting times is long, is to know the reasons why they are long. And the waiting time survey provides you with that. So that is the key thing of the waiting time survey. Because if you know the reasons why there's a long waiting time, then clearly you could move to modify those reasons and thereby shorten the waiting time. It also gives you the service times, which is useful because it gives you the output provided by the facility, i.e. how much time do staff members spend with the patients. From this you can determine the likely satisfaction of the patient in terms of if it was an appropriate service time. As well, you can determine the quality of care, or rather you can determine if there's poor quality of care or whether the quality of care is likely to be acceptable or high. If the service times are too low for the type of service required, then clearly there's likely to be low quality of care. If the service time is adequate or more than adequate, a greater amount of time than is usually required, then one assumes that there is the potential for it to have been an adequate to an excellent service. With the survey you can also measure the type of services being provided to the various patients arriving at the facility. This gives you the case mix of diseases or health problems seen at the facility. Workload can be measured, and workload can be measured in its usual manner, that is as patients seen per staff member per day, But it can also be measured in a more accurate measure in terms of time used. So you can look at the percentage time spent on patients by staff members. The problem with measuring workload in terms of patients seen per staff member per day is that the patients have a different case mix, and hence staff member A seen 10 people per day, but for very serious problems would possibly have the same or a higher workload than staff member B seen 40 patients, but for very minor or for problems that don't require a lot of time to be spent with the patient. So, by measuring workload in terms of actual time spent attending to patients, or percentage of staff time spent attending to patients, one can very accurately determine the workload of the staff. Also, workload is dependent not just on the case mix, but also on the actual time used per patient. So, if you providing a low quality of care, giving very little time to a patient, then you can see many more patients than another staff member providing a higher quality of care and spending an appropriate amount of time in patient. So measuring the workload in patients seen per staff member per day, the one providing the lower quality of care would seem to be working harder than the one providing a better quality of care, if the case mix were the same. The next thing it allows you to see is the arrival times and hence the arrival patterns of patients. And you're also able to determine whether there's batching of patients or not. And this I'll show you later when we look at how to interpret a waiting time survey. Similarly with the workload, we'll show you that measurement then as well. Also, it allows you to determine if there's an appointment system in place, which ideally there should be, and if that appointment system is functioning correctly or not. Because often if there's a bad appointment system in place or a static appointment system, i.e. all patients given the same or similar time to arrive, and often early or first thing in the morning, one could actually worsen waiting times by using such an appointment system rather than shorten them. It gives you a description of the patients who use the services in terms of their demographic profile, and this is limited only by the number of questions you want to pose to the patients who arrive. Typically, it can tell you what type of transport they used and the amount of time it took them to reach the facility from their home or from their work or from whichever destination they left in order to come to the facility. And finally, it can give you the cost of transport. Therefore, taking all that into account, it is clear to see that the waiting time survey would promote efficiency in terms of better functioning of the facility. It would promote equity in terms of workload amongst the staff and matching workload to health need. Clearly, it would promote accountability, as the results, if the results of the survey are made available to the people who utilize the facility, as well as into any facility committee, then clearly how long they take to attend to patients and the functioning of the facility is then clear for everyone to see. This of course aids transparency, and with this accountability and transparency being demonstrated, it is likely that this will translate into greater efficiency, as the people who utilize the facility demand that, as well as the people who manage the facility demand that, and also it allows the people, the staff working in the facility, to reassess what they are doing and looking for opportunities to improve the efficiency and to impact positively on equity. Okay, so clearly all the above can be used, all these measurements can be used then to actually improve the health service provision within any one facility. So, all those wonderful things you can do with a waiting time survey, but how then could we conduct a waiting time survey? Well, option 1. You could follow every patient around the clinic or community health center or hospital and then write down the time they wait and the time they receive a service. This would be very easy to do. However, you would need one field worker per patient, which would be very expensive and would result in congestion of the facility, especially if it's a small facility, because you are automatically doubling the amount of people there. The second option is you can use technology. So you can use a scanner, okay, which will then activate every time a patient with a barcoded tag enters and leaves a service point or a room, a consulting room. The scanner could either be in the door or at a point in the room, or it could be a handheld scanner which the staff member could then shine over the tag. Patients would then have to be given a tag when they arrive, which could be a wrist tag or a sticker which they can put on an item of clothing. So this is obviously an easy way to do it. However, it requires that you have tags, barcoded tags, and you have scanners, and that these scanners link to computers. Then option 3, you could do a similar thing that you would do with a scanner, except that you use a paper form. So if you give every patient a form, and then wherever that patient goes in the facility, staff members complete the form to indicate when they saw the patient, then you would have exactly the same effect as a scanner, except that instead of having a scanner, you now have a paper, instead of a barcoded tag, you now have a paper form, and instead of a scanner, you have a pen or pencil in the hands of a staff member. So we are going to look at measuring waiting time by following a patient with a form. However, note exactly the same principles apply for option 1, 2 or 3. All we are doing is looking at the way in which the data is collected during the actual survey when we look at those 3 options. So this is option 3, but everything from here on would apply equally to option 1 or 2. So, your survey methodology. First of all, you need to determine your study population. This would typically be all patients seen at the facility at which you're going to conduct the study. Now, you can do a waiting time study at any health facility. So whether it is a small one-nurse clinic or whether it is a huge tertiary academic teaching hospital, it makes no difference. The survey methodology remains the same. Although the more complex the facility, the more difficult the logistical problems of doing the survey. However, the principles of the survey remain absolutely the same. So, if the population is all patients seen at the facility, this could be throughout any time period, you would then need to get a sample. And the best way to get a sample is a time delimited sample, i.e. you choose a particular time period. So it could be a session, a day, a week, a month, etc. Usually, 1 day is sufficient to give you an overall assessment of how the facility works, if every day at the facility is the same or similar. So, if your services provided are homogeneous, i.e. all services are provided every day of the week, then assessing 1 day would be sufficient to assess all the services provided in a facility. However, if the services provided are heterogeneous, i.e. some services are only provided on a Monday, some only on a Wednesday, etc., then if you did 1 day, you'd only know about the services provided on that day and not about the services provided on the other day. Hence, you might then, for that type of facility, have to do more than 1 day, and usually a week would then be enough. However, in many cases, a week might not be necessary, as if the variety of services could possibly be covered in 2 or 3 days. So, when you sample, it's best to take all patients that you see in the time period. So let us assume we take in 1 day. So if you take every patient that comes on the day, then you can look at the range of waiting times throughout the time period, a day in this case, of all the patients who arrive. This means that the arrival patterns of the patients will be captured. And this is important because patients come in at different times of the day, might have different waiting times. Also, patients come in at different times of the day, might come for different services. So taking everyone who comes in the time period will allow you to give an overall picture of the facility. However, taking a particular time period has the potential to allow bias into the study. This is if the time period you choose happens to be a particularly busy or particular quiet time, or if the time period you choose there happens to be a time when there's not sufficient staff, or it just happens to be an abundance of staff, and so it doesn't reflect what typically happens in a facility. Hence, if you're going to have a time period, you must be very careful to choose a typical or average time period. So, if you do in 1 day, and this suffices for most facilities, except for the more complex tertiary facilities. So if you choose 1 day, then you must choose an average day. So you would want to choose an average day in an average week. So don't choose a busy day, don't choose a quiet day, choose an in-between day. Typically in South Africa, at clinics and health centers and hospitals, that would be a weekday, usually Wednesday or Thursday. However, you might want to also see what is the waiting times on other atypical days. So for instance, in a hospital or a 24-hour health facility like a community health center, you might want to know what is the waiting time on a weekend versus on a weekday. Because on a weekday you would have your usual outpatient sessions plus emergency unit running, whereas on a weekend there's likely to be no outpatient sessions or very few, and it's mainly emergency services running, and you'd want to know for those emergency services what are the waiting times. Then you'd want to choose that weekend day, perhaps a Saturday, and perhaps choose a weekday, perhaps a Wednesday or Thursday. For a facility that doesn't do emergency units, you just need to choose 1 day in the week, which will then cover the outpatient sessions and then the emergencies that come during office hours, and naturally they'll be closed after the office hours. So choosing an average day or an average time period, choose the day based on the day in the week, e.g. a Wednesday, in which it's neither busy nor quiet. This means that the waiting times for that day would be what would typically happen. However, you would know that on a quiet day it is likely the waiting times would be shorter, and on a busier day it is likely the waiting times would be longer than the result you get for when doing the survey on that day. Also, make sure when you actually do the survey on that Wednesday, for example, that you do it in an average week in the year. So, do not choose a week during which there is some health campaign running, or do not choose a week during which staff might be absent, for instance during school holidays, or when there's training sessions happening. Okay, so you would And do not choose a week in which there is one or more public holidays, because that would usually, if there are public holidays in the week, on that weekday, it would affect the other weekdays. So if there's a public holiday on the Monday, then the Tuesday might be busier than it would usually be on a Tuesday, and similarly the Wednesday. As those who should have come on a Monday, would have come on a Monday, now have to choose another day. Okay. So once you've chosen your average day in the week, choose an average week in the year for that facility, and then conduct the survey on that day. For data collection, we'll now move to the details on that. So, collecting your data, we already know that a form is going to move with the patient around the facility. So, at every point where a patient accesses services and can wait for those services, you would then want to measure. So, all outpatient visits, all emergency unit visits by patients, and all direct admissions to the ward seen on this average day will then be time tracked, okay, from the time they arrived until the time they depart the facility, using this timesheet or paper form. Of course, inpatients are excluded from the survey since they are not waiting. They are assumed to be always receiving a service, and this obviously they don't have a staff member next to them all the time, but even while not having a staff there, they are being observed and assessed, and hence they are receiving a service, i.e. they are in a bed. The first thing to record is the arrival and departure times. This would have to be recorded by field workers, as the arrival and departure times are recorded when the patients enter the facility. Then at every point which a patient receives a service from a staff member, e.g. reception or nurse station or doctor station or pharmacy, the staff member who attends to them then records the time, and they record the time that they start attending to the patient and the time they stop attending to the patient. So that means that wherever the patient receives a service within the facility, the staff member providing the service will record the time on the form which the patient has with them. Then, to complete the picture, the staff member needs to complete a timesheet which tracks the time that they spent at the facility. This is because a staff member could work at more than one service point, and therefore we need to know what time they had available to work at the service point. So for instance, a nurse could work at the TB service point and then move to the contraception clinic service point, and then move to the emergency unit, and then move to help out at reception, and then move back to the TB point, etc. So if we track the time they spend at each of the service points where they work, we then know how much time they had available to spend on patients at that particular service point. The staff members, similar to the patients, must record the time from when they arrive at the facility till when they depart. So they record the time they spend at the various service points, as well as record the time when they are not available to see patients, e.g. when they have to do administrative work, or they have to attend a meeting, or they have to go to a lecture, or they have to go off-site for some visit in the community. Then, when we mentioned that there was added information you could get from the waiting time survey, some of this is obtained from a short questionnaire, which patients fill in on the arrival and on the departure. And staff also complete a short questionnaire. So, the patient questionnaire on arrival. This questionnaire just collects basic information on the patient related to the analysis of the waiting time survey. However, it could collect additional information if you wanted it to, and this would then mean that you get additional information from the survey at a very high efficiency, because some very basic information, and basic but useful information, can be collected and tagged on to the survey. So the following is what you need to analyze the waiting time survey, as well as additional things. So you would want to ask what type of transport they used to get the facility and how long it took them to reach the facility, as well as the cost, if there was any cost. Clearly, if they walked, there was no cost, or if they got a lift with someone who didn't charge them, they probably wouldn't have a cost as well. The next thing is we want to know if they had an appointment for their visit, which is a yes/no answer, and if yes, then what time was the appointment for. And generally this time would be written on the appointment card. You can collect the age and gender of the patient and where they live. Getting where they live allows you to determine the drainage population of the health facility. Then additional questions can be asked depending on what you are interested in. For example, are they on medical aid or medical insurance? And are they employed? Do they get a grant? What standard of school they manage to achieve, etc. Then on departure, you would want to ask a couple of questions related to waiting times. The one is their perception of the time they waited. So what amount of time do you think you waited today? And then secondly, you'd want to get an idea from the patients who access the services at the facility about what they believe is an acceptable amount of time to wait at the facility. These questions are straightforward and should usually not take more than 1 minute. It's important to keep the time of the questionnaire short, because you don't want to delay people who are keen to now leave the facility, nor do you want to delay people on their way into the facility and anxious to get their folders and be seen. Hence, keep it very short, which means that although there's efficiency gained by adding on questions in terms of the amount of information you can get, this must be balanced against the cost of then getting that information and the time you spend in detaining the patients. The staff questionnaire. From the staff, in order to interpret the waiting time survey, you want to know whether there's anything that would prevent them from attending to patients or delay them from attending to patients. So you want to know if they have sufficient space to attend to the patients, and you want to know if they have adequate equipment. So if they don't have sufficient space, i.e. there's no room in which to, let's say, counsel a patient, then even if the patient is there and the staff member is there, the patient would be waiting, because they'd be waiting for a room in which to counsel them. Similarly, if there was no consulting if there was no consulting table on which to examine the patient, it might be difficult to have to wait. Or if you needed an otoscope and it wasn't available, or a thermometer or an ECG machine, etc., then this would result in the patient waiting, even though a staff member is right there ready to attend to the patient, and the patient is obviously present as well. Then it's useful to get from the staff the amount of time that they would generally spend on the patient for the services they provide. And this is useful by asking them the average amount of time they spend on the patient, as well as the minimum and the maximum amount of time that they would likely spend on the patient. Okay, this is then can then be used to assess quality of care in terms of the service time spent on the patient. Then, crucially, you'd want to know, you have already asked the patient what amount of time is acceptable to wait. Now it's useful also to get from the staff what amount of time do they think it is acceptable for a patient to wait for the services which they provide. So, looking at this now, how would you do this in practice? So here is a sketch of a health facility. Let's call it a community health center. So here are the entrances to the facility. Here are the various service points: reception, a nurse consulting room, a doctor consulting room, a counseling room, patients with HIV, a triage section, a TB room, a pharmacy, and here's a waiting area with some chairs in it. So, tracking the patient with a form, this particular patient entered the building at 9:01. He then either sat on the chairs or stood in a queue in the waiting area here, and then was called to the reception window at 9:24, which means that this patient effectively waited from 9:01 till 9:24, or waited for 23 minutes. Reception then collected his folder, told him where to go, and he then left the counter at 9:26. This then means that the patient received a service of 2 minutes, or 9:26 minus 9:24, at reception. So the service at reception was 2 minutes, the waiting time at reception was 23 minutes, 9:24 minus 9:01. The patient was then went to triage and was called into the triage room at 9:33. This means that the patient waited from 9:26 to 9:33, or 7 minutes. The patient then left the triage room at 9:37, indicating a 4-minute service time, and went to the consulting room of a professional nurse, which they entered at 10:23, indicating he waited from 9:37 to 10:23 to obtain the services of the nurse. So the patient waited 46 minutes, or 10:23 minus 9:37. The patient then left the nurse consulting room at 10:33, showing that he had a service of 10 minutes. From the nurse he went to the pharmacy, where he was called in at 10:59, which means that he effectively waited 26 minutes to get to the pharmacy, or 10:59 minus 10:33. He then left the pharmacy at 11:03, showing that he had 4 minutes of service, and then left the building at 11:05. Okay. So this then is how you tracked one patient with a form throughout the facility. And of course the same would have been true if the patient had a barcoded tag and there was a scanner at all the facilities. Or indeed, if someone had followed the patient and recorded these times. These times were, however, recorded on the paper form by the staff member at each of the service points, according to the methodology we chose to follow. So, putting it together, the patient arrived at 9:01 and departed at 11:05. He first went to reception. Here's his time in and his time out, from which we can calculate the service time, and taking the time in and comparing it to the time they arrived, we can get the waiting time. And similar for all the other service points which the patient attended. We can then add up all the service time, the partial service time, at the facility, i.e. the service time for each type of service that was rendered to the patient, to get the complete service time. In this case it is 20 minutes. Similarly, we can look at the partial waiting time or the waiting time for each of the service points, and we can add it up to get the complete waiting time for a visit to the facility. In this case, 102 minutes. So, to collect the data is then very easy. You simply give a form or a timesheet to every patient, and every staff member who sees the patient fills it in, as well as a field worker filling in when the patient arrives and departs. And a similar concept for a staff timesheet. So what would a patient timesheet look like? It would resemble something like this, where you have the facility name, some details on the patient, the questionnaire provided to the patient, and then it has various service points on there, and the service points on the form would obviously be the service points that are provided at the facility in which you're doing the study. Then it has a space for a staff code and the time in and out. And if you want to collect extra information, for example the case mix, and here we're looking at the case mix at triage, was it minor, serious or an absolute emergency, you could then determine that. The staff member would then just tick what the particular case mix was for each patient they see. So, filling in this form, when the patient arrives at the facility, the field worker will fill in the arrival time and then capture things on the questionnaire, such as the gender, age, the suburb they live in, and the type of transport, in this case a taxi. The patient then enters the facility and goes to the services. Once he goes to the services, the staff member who sees him at the service point then fills in the time in and the time out and indicates their code. And every staff member is allocated a code, or which typically consists of a few letters, or they can choose their own code provided they know how many letters to choose. And this allows us to track which staff member saw which patient at which point in time, which would help with the analysis later. The staff member would then keep the same code throughout the study. So for the 8 to 9 hours if it's an office hour facility, or the 24 hours if it were an emergency unit in the facility. At some service points you might want to look at the case mix, in which case the staff member seeing the patient would indicate what the case mix was, and typically, in order to save time, you must break down this case mix into predetermined categories, which the staff member can then just tick off. It's always useful to have an other category to catch anything that doesn't fit in any one of the predetermined ones. And again here, the staff member seeing the patient would fill in the code, time in and time out. And now you can see why it takes less than 10 seconds. You simply fill in your code, which is the same always. You fill in the time when the patient arrives, and you fill in the time when they leave. Then this patient went to pharmacy, and from here again we see the code, time in and out. And now here there's a different case mix, as indeed at all the places you attend there might be a different case mix of services that you are interested in for that particular service point. So for instance, the nurse and the doctor have a particular type of case mix, the dentist has a different one, the psychologist a different one, etc., that they are interested in. So here at the pharmacy they're interested in to know whether it's new or repeat, as well as whether they were able to fully dispense the medicine or whether they did not manage to fully dispense the medicine. So in this case, all the medicines on the script were dispensed, and it was new medications rather than repeat. Again, there's the code, the time in, the time out. Very simple. And then here's the departure time. As the patient leaves the facility, the field worker records the departure time and takes the form from the patient, or takes the form from the folder if it were held in the folder. So that completes the timesheet for the patient, which is extremely simple, and every staff member just fills in at the section which is relevant to them. That means the section where they provide in services. So a staff timesheet follows a similar pattern. All you do is track the staff member throughout the day, which means that the staff member would have to fill in the timesheet throughout the day. And there would of course be one timesheet per staff member. So here's an example of a staff timesheet. There's the facility name, type of facility, the date, then the staff code. So the staff member will fill in the code they're going to use throughout the day, and this is the same code that they will use whenever they see a patient. They fill in their arrival time, when they arrived, and what category of staff they are, i.e. nurse, doctor, clerk, pharmacist, radiographer, etc. Then on this timesheet there are various service points. These would obviously be the service points that are pertinent to the facility, as well as other activities that staff time could be utilized for. So for instance, administration, management, any outreach, any meetings, workshops, any other clinical work. So this would include clinical work where a patient is not present. For instance, compiling summaries of patients, or writing letters, or referral letters, or going through results of tests, etc. Or in any other work that could apply. So if a staff member is engaged in any of these activities, then they're obviously not available to see patients, and hence would impact upon patients waiting. Whereas if they are at a service point where they attend to patients, we then know for what period of the day they were there and at which service point. Tea breaks and lunch breaks are also inserted, because clearly while a staff member is having a well-deserved tea or lunch break, again they cannot attend to patients. Okay, and so hence the patients who come in close to these times might then wait a bit longer than those who don't. So filling in the form, really simple. When you arrive at the facility, the staff member is handed the form, and she fills in her arrival time, her staff category, and either gets a code assigned to her, or else she chooses a code of her own. In this case 3 letters, EGT. Then she indicates where she starts work, and here we can see she started working at the professional nurse station from 7:47 and kept working there till 9:32. Now note the 2-minute delay here between the arrival time and getting there, and we're not interested in the small amounts of time. So in this time, of course, she would have been in the corridor or chatting to another staff member, etc. Okay, and we're not interested in those small amounts of time. So this could be anything. Okay. Then she worked in TB dots from 9:34 to 10:12, and again 2 minutes is lost. So this again could have been a quick smoke break, or hopefully not actually, or chatting to a colleague, or answering a telephone, or whatever. Okay, but we're not interested in these small gaps in time where they're not at a particular service point. Then after that, was working in the TB dot station. She took a tea break for that period of time. Then she went back to the professional nurse service point and worked there until just after 1 o'clock. So very simple to fill in, very easy, no problem at all. Then at 1 o'clock had a short lunch break, then back again to the same station. Thereafter had a meeting of about half an hour, and then finally departed at the end of the day. So extremely easy to fill in and very accurate, provided the staff fill it in as the day progresses, so that they clear, well, I started here, I left it at that point, I went somewhere else, I left that place at that point, then went somewhere else, left there again, came back, etc. Okay, so very simple, just fill in the times where you are at different points throughout the day. So, the important thing to note is that the staff are the primary data collectors in this survey. They fill in the patient timesheets, they fill in their own timesheets. The field workers only note the arrival and departure times of the patients. And of course they administer the patient questionnaire, the short patient questionnaire. Now, moving on to analyze the data you'll get for this. Your basic analysis is to look at the waiting time. And you'd want to look at the overall waiting time for a visit to the facility. So you'll get the overall waiting time, and we've shown for one patient how to calculate the overall waiting time at the facility, or the complete waiting time. It's simply adding up the waiting time for each of the service points. However, when you have a group of them, you would then want to get the average waiting time for the patients at the facility, or the median waiting time. And typically a waiting time survey, the data is skewed, so you'd want to use a median waiting time rather than the average waiting time. Similarly, you'd want to look at the waiting time for each of the service points, and again you do it for an individual patient, and you'd want to see the median for all the patients coming there, because again it's skewed. If the data were not skewed, you would get the average, but it invariably is skewed because some patients might wait a very long time, and you don't want to be utilized. That would then push the average much higher than the median would be, waiting time would be. So you'd want to assess the median waiting time because of the skewed data you receive from a waiting time survey. You would then want to, similarly to the waiting time, look at the median service time for the facility overall, as well as the service time for each service point, and see if it was appropriate or not. So your basic analysis for the whole facility would then be the median waiting times and the range of waiting times, going from the 5% to the 95% cutoff. So typically you'd want to look at perhaps the interquartile range, or the 25 to 75% cutoff, as well as a wider range, perhaps the 5% to 95% cutoff for the waiting times, and the same for the service times. And we'll show you this shortly. So the survey methodology then, we've gone through the study population, we looked at the sampling, and we've just completed the data collection. So clearly the study has face validity, in that you're actually measuring the actual times they get a service and the actual times they wait. It also has construct validity, in that you're looking at the service times for each of the service points, and then simply adding it to get the complete service time for and complete waiting time for a visit to the facility. There's low bias in the sampling, provided that you took an average day of the week and an average week in the year in terms of patient utilization as well as in terms of staffing ratios at the facility. Your measurement would clearly be correct provided that everyone has synchronized their watches and everyone takes some degree of diligence to put down the correct time that they actually saw the patient. It's reliable in terms of if you repeated the survey, you are highly likely to get the same results again. Then you need to do data entry and cleaning. Fortunately, there's a customized software database available for this, which is free and open source software, so it's available to anyone who wants it. Okay, and this allows you to easily enter and clean the data, and it also has standardized cleaning rules written into the software, okay, to assist you with cleaning the data. The analysis procedures in the software database are standardized, and in fact they are semi-automated. So once you've entered that and then cleaned the data, your output results are immediately available. This then leaves the interpretation, okay, and note that what follows is a generic interpretation. However, there might be contextual differences between facilities, and one should always bear that in mind when interpreting the data from a waiting time survey. And you would therefore want to moderate your interpretation based on the contextual knowledge that you have of the way in which services are provided at any one particular facility. So then, let us now move to interpreting the results of the waiting time survey, and we'll just pause there for a while. So now let's look at how to interpret the results of a waiting time survey. This is a typical output you'd get from a waiting time survey. This is a summary of the main results, and this is obtained in an automatic manner from the database into which the data was entered. So exactly as you see it here, this is how it would pop up from the database when you click on the desired report. So what we have here is a community health center A, and we know there were 29 staff present in the community health center, of which the full-time equivalent was 21.3. A full-time equivalent staff is a staff member who works for 8 hours of the day. Then the number of patients arriving at the facility was 208, of which 17 or 8.2% were turned away. And then of those who were turned away, none of them were given an appointment or a referral to another facility. 5 patients left voluntarily. In other words, they came to the facility and then decided that they were waiting too long, and so they left of their own accord, and this is 2.4% of patients. On average, patients visit 2.8 service points. Here you can look at the appointments given, and as you can see, many patients get an appointment, 61%, but no specific time is given. So they get an appointment for the day, but they're not given a time at this facility. And then 39% had no appointments. Here we're looking at the waiting and the service time. The bottom row, the waiting time, we can see that on median, the patients who attend Community Health Center A wait 196 minutes, or just over 3¼ hours. And for that time, on median, they get a complete service time of 8 minutes. The service time, of course, ranges from between 1 to 33 minutes. This would probably be for a very simple case, and this would be for a more complicated case with the patient. The waiting time ranges from 3 minutes, the cutoff of 5% of 3 minutes. This means that 5% of the patients waited 3 minutes or less for their complete time at the facility. However, on the other point of the scale, the cutoff, the 95% cutoff, is 433 minutes, or 7.5 hours almost. This means that 5% of patients waited more than 432 minutes, or just about 7.25 hours. Similarly with the 25 and 75% cutoff. So at the 25% cutoff, we know that 25%, or a quarter of patients who attended this facility, waited 30 minutes or less for their complete visit to the facility. While at the 75% cutoff, here we have that a quarter of patients waited 300 minutes or more. That is 5 hours or more at the facility for their complete visit. Okay, so what we can see is that this particular facility, CHCA, has a very high waiting time on median of over 3.25 hours, and some of the patients who arrive there wait very long. A quarter wait more than 5 hours. If the median is 3.5 hours, 3.25 hours, sorry, it means that half the patients wait more than 3 hours to be seen. Of course, half wait less, and as we see, some wait a very small amount, wait a very short time, and a quarter of them wait a reasonably short time of 30 minutes. Again, there's that 5% who wait very, very long at this community health center. Now looking at community health center B, a very similar report. Again, there are 29 staff, full-time equivalent of 20.8. Again, a full-time equivalent staff is a staff member spending 8 hours of the day there. Okay, so obviously a staff member who's there part-time, and let's say only there for 4 hours, would be counted as half a staff member. And someone who worked for 12 hours would be counted as 1.5 staff member, because that would be the equivalent of 1.5 staff members working 8 hours, or half a staff member working 8 hours, the 4 hours and 12 hours respectively. The patients arriving, very similar again, 285, of which a smaller amount were turned away, and 40% of those who were turned away were either given an appointment to come back or a referral letter to go elsewhere, and 1.8% left voluntarily, a similar number of visits per service point. So very similar facilities, one would gather, Community Health Center A and B, when we look at their profile, the staffing, the patients, except that we've seen Community Health Center B sends away far less patients than Community Health Center A, and they give quite a bit of them an appointment or a referral, whereas Community Health Center A sends away quite a lot, turns away quite a lot of patients, and gives none of them an appointment or referral. Here we can see again, appointments are provided to patients for the day, but usually they're not given a specific time. Only a small amount of patients were given a specific time of the appointment, and as you see, those who were given a time were given a time for early in the morning, mainly, with a few scatterings throughout the day. But the vast majority given appointment were not given a time. They were just told to come on the particular day. Okay, and just under 44% had no appointments. Now, looking at this, the complete waiting time is 56 minutes, or just less than an hour. And it's similar service time of 8 minutes with a range of 2 to 29, which is very similar to Community Health Center A, with a range service time of 1 to 33 and 8 minutes on median. However, their waiting times are very different. So this is where the health centers differ dramatically, in that the waiting time of Community Health Center B is less than a third of Community Health Center A. So Community Health Center A, you wait 3 times longer on median or on average than you would at Community Health Center B. And here again you can see the range of waiting times. So 5% of patients wait less than 5 minutes, 25% or a quarter wait less than 13 minutes in this case, whereas 5% of patients wait more than 3 hours. Contrast this to where more than half the patients wait more than 3 hours, because as you can see the median is 196, as opposed to here where the cutoff point, the 95% cutoff point is below the median waiting time of Community Health Center A. Okay. So the question is, if they gave a similar service, a similar quality of care, which Community Health Center are people likely to want to go to? And which Community Health Center would you like to go to? Now, as we mentioned before, just knowing that the waiting time is high is not that helpful, because staff and patients probably already knew that the waiting time at their facility was very high, only now we've quantified it. But so what if we've quantified it? How's that going to help? How would you reduce the waiting time? In order to reduce the waiting time, you would need to know the causes of the high waiting time. Because then once you know the causes, you can then address them and reduce the waiting time. So, what are the causes of a high waiting time? At a community health center or clinic, there are 8 causes of a high waiting time. If you would look at an emergency unit, there would be 10 causes. So there are 2 additional causes for emergency unit. For a health center and clinic, there are only 8 causes. So, if there are only 8 causes, and if your survey measures all 8 causes, then you could determine which one of them, or which combination of these causes, was determining this high waiting time. And if you knew which one of the causes or which combination of the causes, you could then institute actions to ameliorate that cause and hence reduce the waiting time. So let's look at each of the causes in turn. So a high workload. Clearly, if staff are overloaded, overworked, then patients are going to wait, because they're waiting while the staff are busy with the other patients. Similarly, if there's a high service time, or rather the service time is inappropriately high, then patients would wait. So it's very nice for the patient getting this long service, but it's not so good for the patient next in line who's having to wait while someone else gets a long service time or a high service time. Now, if it's appropriate that this person get a service time because they're a complicated case or there's some procedure which takes a long time, then that's fine. However, if it's inappropriately high, in other words, the patient could have been seen with high quality of care in a much shorter time, then it would be a problem. because your quality of care would be the same. However, you take in a longer time, and hence others in the queue are waiting. Logistical problems could cause a high or long waiting time. This is typically when the staff are available to see the patient is present to be seen by the staff member, but there's no space in which to see the patient, or there's no equipment with which to see the patient. Hence the patient has to wait before being seen. So that would be a logistical problem, and that relates to space as well as equipment. Then big batches of patients arriving. This is a very potent cause of high waiting times. So, if 20 patients all arrived at once, at the same time, let's say 9 o'clock in the morning, and they all want to see the doctor, clearly the doctor is going to see them one at a time. So even if the doctor had no other patients to attend to, these patients arriving in a big batch, most of them would wait a long time. Because of the 20 patients, the first one to see the doctor would wait 0 minutes. He would see him immediately, since there's no one else there to be seen. However, when would the second one be seen? He'd only be seen once the doctor had completed the service of the first patient. So if the first patient takes 10 minutes, the second patient would be waiting for 10 minutes. Similarly, if the second patient takes 10 minutes, then the third person in that batch would be waiting for 20 minutes. And the fourth person would be waiting for 30 minutes, because the doctor first has to see the 3 other patients. And of course, number 20, unfortunately, would wait for 190 minutes, or there'd be 19 patients ahead of him. So you can see, coming in a big batch means that the patients who are seen later in the batch would be waiting an enormous amount of time. Also, big batches cause a knock-on for those arriving later. Because if there are other patients now arriving at 9:30, clearly they can't be seen then, because they'll still be waiting until that batch of 20 patients that arrived at 9 o'clock get seen, and only thereafter will those who are arriving afterwards be seen. Queuing problems cause high waiting times. This means that patients are not seen in the order they arrive. So a patient could have arrived third, and then only be the 20th person seen, which means that somehow in the queuing system they were passed over while others got seen. This typically happens when there isn't good signage to tell patients where to go, and they might be waiting in the wrong place, or if while waiting the patient temporarily went somewhere else and then didn't hear their name being called, or if they were sitting there but didn't realize they were being called, or if they simply don't know the queuing system and therefore didn't realize it was their turn. A mismatch of staff and patients. This can cause large waiting times. This happens when patients arrive to be seen, but the staff are not yet there to see them, or the service point of the staff hasn't opened yet. Okay, so if staff are due to see patients from 11 o'clock onwards, because before that they are busy in a meeting or they're busy doing other work, then if the patients arrive before 11, then clearly they will wait until 11 before the staff member starts seeing them. Yes. So this can be a potent cause of high waiting times. Inefficiency in prioritizing patients. This means that the patient is there to be seen, the staff member is present to see the patient, but the staff member, instead of attending to the patient, does other activities. Okay? So if the other activities are absolutely emergencies, that would be fine. If they are not, the consequence is, while the staff member engages in other activities, the patients are waiting. Flow problems. This means that the staff members are there to see the patients, but the patients are being held up somewhere else, and hence they can't be seen. So, now looking at these causes operate at individual service point level. So this means for every service point in a facility, if the waiting time is long or high, one or more of these causes would be operative, causing that waiting time to be long or high. So, if we want to then look at why the waiting time is high in this facility, we must now go and look at every service point and see which one or which combination of these causes of a long or high waiting time are present at that service point. So let's do that now. So here at the facility with a high waiting time, we have the service point reception, and as can be seen, the waiting times here at reception are very high. So just for this service point, just to get your folder at reception, patients are waiting on median 99 minutes, or more than an hour and a half. A quarter of the patients are waiting 141 minutes, or more than 2¼ hours, and 5% of the patients wait for 184 minutes, or more than 3 hours. So 5% of the patients are waiting for more than 3 hours at the facility, at the service point, reception service point. Okay, now here, this column show the service times at the service point, reception, and as you can see on median, the service time is 1 minute, and with a range from 1 to 5 minutes. This means that the staff at the service point are actually very fast or very efficient at pulling out the folders for the patients and directing them where to go with their folders in order to obtain their definitive service in the community health center. So here a low waiting time, provided that the correct folder has been extracted, is a good thing. A low service time is very good. So here we see that the staff are technically very efficient, and despite this technical efficiency at getting out the patient's folders, patients are waiting a very long time. Also here, these columns show the number of staff or equivalent staff present, and you can see there's 5.5 or 5.5 equivalent staff present, the number of patients they saw, and this is the percentage staff time spent attending to the patients. So this is a very accurate measure of the workload of a staff member, because of the time they had available to spend on patients, how much of it did they actually spend on patients? And so here we can see they spent 26% of their time directly on patients, which means 74% of their time they spent on other things. However, you'll see here in brackets that there's a 39%. This is because the reception staff actually spent 39% of their time on patients. However, some of that time that they directly spent on the patient was done while the patient wasn't there. And remember, our survey worked where you'd measure the time spent on the patient while they were there. So what happens at reception is when patients are there, they would pull out the folder, gather information from the patients, and inform the patients where to go next. However, since they've taken out the folders, they also have to put them back and put them back in the correct order. And here we've got added in that time. So it is a rough estimate that it takes about half the time to put back correctly the folder than it did to take it out and gather information and direct the patient where to go. So half of 26 is 13%. So adding 13% to 26 gives 39%. So staff at the reception are spending 39% of their paid time directly on patients. And this is an indication of their patient workload or their clinical workload, if you like. Directly patient-linked workload. So, we now know that they wait a long time at the reception. So at least we know where in the facility they wait in a long time. Clearly it's reception is one of the places. But that still doesn't tell us why they are waiting this long time. So the question now is why they are waiting a long time. In order to do that, we must look at each of the causes in turn and see if that cause is operative at the service point. So, cause 1, a high workload. Are patients waiting because the staff are overworked at this reception point? And the answer is no. Because as we saw, the workload of the staff is 39%. Okay? So they spend 39% of their time directly on patients, which means they have 61% of their time to do other things. So they're not overloaded. Okay? There is not a high workload. That is not the cause of the high waiting time. So what then is the cause of the high waiting time? Is it a high or long service time? And again we see no. On the contrary, the service time is very short. Okay? Which might be a problem at some service points. But at a non-definitive service point, such as a reception, which just does support work, a short service time is not a problem. In fact, patients might prefer it, provided that everything gets done for them. So in fact, these service times are definitely not high, and so it's not due to the high service time that the waiting time is high. So then, what is it due to? Is it due to logistical problems? Okay? Now, if you'll recall, we asked the staff these questions in the staff questionnaire. Okay? Do they have sufficient space? Do they have adequate equipment? If any one of the staff who work at this service point had indicated that that was a problem, then we would have assumed that yes, there is a logistical problem at that service point. However, if all of them say that they have sufficient space and they have sufficient equipment, we would then conclude that there are no logistical problems that would relate to waiting times. So one or more staff members indicate there's a logistical problem in terms of space or equipment, and it is recorded as such. All of them say that there isn't, then it's recorded as no. So what did they record it as? They recorded it as no. They indicated that they have sufficient space and they have sufficient equipment, such that the patients wouldn't have to wait on account of that. So, not due to a logistical problem. So we're nowhere nearer the answer yet. So what is it due to then? Okay, could it be cause number 4? Big batches of patients arriving at the same time. Let's look at that. So here we have an arrival time graph. Okay, it's a graph of arrival times. And what we have here on the x-axis is the times of the day from 1 minute after midnight to midnight. Okay? And here we have it in hourly sections. So here you have 4 to 5, 5 to 6, 6 to 7, 7 to 8, 8 to 9, etc. in hourly bands throughout the day on the x-axis. Then on the y-axis you have time in minutes, and on the other y-axis you have the number of patients arriving, okay, and the number of patients given an appointment for that time. So the red line is number of patients arriving. So looking at the solid red line here, we can see how many patients arrive at different times of the day. So we note here that the first patients start arriving just before 4 o'clock. Okay? So just before 4 o'clock, the first patients start arriving. Then some more come between 4 and 5. Then between 5 and 6, a lot more come. Then at 7, a huge amount of them come. If you look at reading it off on the x-axis, it's about just short of 100 patients arriving. Whereas at 6 o'clock, about 50 patients arrived. At 7, 100. At 8 o'clock, again 50. Then at 9, just about 45. At 10 o'clock, less than 20 patients arrive. At 11 o'clock, there's about 5. 12 o'clock, about 8. At 1 o'clock, about 4. At 2 o'clock, about 2. At 3 o'clock, another 2. 4 o'clock, 2 or 3. 5 o'clock, about 7 or 8. At 6 o'clock, about 8 or 9, and so on. Okay, so what we are seeing then is that we are getting a large batch at 7 o'clock for 100 patients, and at 6 o'clock and 8 o'clock and 9 o'clock. So indeed you can see here large batches of patients arriving early in the morning. And clearly this, as we noted before, is going to result in a very high waiting time for these patients. And indeed, if you look at the waiting time of the patients, which is shown here by these bars, okay, these red or purple red bars, you can see here, this shows the median waiting time if you came at this time in the day. So if you arrived at 7, then on median you would wait 100 minutes. Okay, if you arrived at 6, then on median you would wait 135 minutes. If you arrived at 9, then on median or average you would wait 75 minutes. Read off this x-axis. So as you can see, coming in a big batch results in very high waiting times. Also you'll notice the appointments, the number of patients with appointments, they are given in blue here. Okay, and you can see very few patients had appointments, and those who did indeed had the appointments for 8 o'clock. And now here you see the appointments given at 11. Okay, now this doesn't mean that they were given appointments at 11 or midnight. This just means that there was no appointment. So in order to get them on the graph, we can see these more than about 150 patients arrived who had no appointment. Similarly here we can see about 50 patients arrived, but they had no appointment time. So there's no specific time is shown on the graph here conventionally at the midnight to early morning, and no appointments is shown as just before midnight to 11. Okay, 11 to 12 in the night. Okay, and so that, and you see the vast majority did not have appointments, and patients arrived in batches in the morning. Okay, so now we found the cause of the high waiting time. But could there be other causes of the high waiting times? And yes, there could be. There could indeed be. But just before we move on to that, the question is, why do patients come in big batches early in the morning? So why would they come there if they're going to wait a long time? And typically typically the reasons given for arriving in a big batch early in the morning is fear. Fear that you will be turned away. So if larger numbers of patients are turned away, then patients will fear that they'll be turned away, and they don't want to be in the group that comes late and then gets turned away. So they come earlier in the day, resulting in large batches of patients coming earlier in the day. Of course, patients could also come earlier in the day because it's convenient for them to come in terms of transport or in terms of their activities for the day. It is better to come then. Although again, this would be strange, since coming that early means that they are automatically consigned to these incredibly large waiting times. Now, could there be other problems causing a high waiting time? What about queuing problems? Again, looking at the arrival time graph, we can determine if there are queuing problems or not. So, if you look at these T bars, these lines here and the bars across them, this tells you how long. So the red tells you how long on median you wait if you arrive between 7 and 8. Whereas the black bar line and the T bar tells you how long, what was the longest time that was waited by someone who arrived between 7 and 8. And as you can see here, one person waited more than 250 minutes or more than 4 hours. And the way to determine if there was a queuing problem or not would be to see if those who came after this person got seen before him. And a rule of thumb way to do that is if you take the two median waiting times, the median waiting time for this group and that, and you put it on top of each other. If the bar sticks out further than that, then there's a queuing problem. Because essentially what it means is that the median number of patients got seen here, and those who came afterwards also got seen, and yet some of the people who came during this period had still not been seen. So you'll see here the median waiting time here was 100 minutes. The median waiting time here was 130 minutes. So if you take this 130 and put it on top of 100, you would get 230. And you can see the bar is sticking out beyond that. So indeed there was a queuing problem for a few patients here. Okay. Now you can see that there wasn't a queuing problem early in the morning, because the median waiting time there was 230, and the next batch was 140. So 140 on top of 230 would be way off the scale, and certainly there wasn't any queuing. Similarly, between 5 and 6 there was no queuing, because the median waiting time was 140, and the median waiting time at 6 was 135. 140 on top of 135, again right to the top of the graph here, and so you can see it's well beyond the bar, so there was no queuing problem there either. Similarly, but however, between 7 and 8 there was a small queuing problem. Between 8 and 9 there was no queuing problem, because again you've taken a median waiting time of 130 and one of 75, you put it on top of each other and it extends well beyond the bar there. However, you can see here at 12 o'clock there was clearly a queuing problem. So the median waiting time here has now gone down to 25, and at 1 o'clock it's 5 minutes. So, and yet someone waited more than 150 minutes here who would arrived at 12. So that means that those who came after that person had been seen, and yet they were still waiting to be seen. Similarly at 11 and 10 there's queuing problems. So you can see there are queuing problems at different points in the day, and at other times during the day there are no queuing problems. Okay, so are there other causes then of high waiting times? Is there any mismatch of staff and patients? To assess that, you'd need to look at a different type of graph called the snapshot graph. This graph looks at all the patients over the period of time. This is a true manager's graph. So if you were the manager of a facility and all you did all day long was to sit outside the reception and watch who is waiting and who gets served, this is what graph is what you would have seen. So what you have here again is the hours in the day, in hourly patterns, and then every minute of the day then recorded here. Although the intervals here are shown are 5 minutes, but every minute of the day is recorded, since you recorded the patients and the staff throughout their time at the facility. So to read this graph, here you have time in minutes. Here on the y-axis you have number of patients and number of staff. So the red, the dark red, is the number of patients arriving and who are not attended to yet. So they arrive and they don't get a service. And you would read it off this axis. So you can see here at about 4 o'clock patients start arriving, small numbers of them, then at 5 more, 6 more, and at 7 a large number of patients arrived, so that at 7:15 there are about 150 patients in the facility waiting. Okay, so they arrive and then they wait. Then here the solid blue line here, the thick solid blue line, is the staff. Is the staff arriving. So as you can see, at 7 o'clock 2 staff members come, and then at 7:15 another staff member comes, then 7:30 another, 7:45 another, 8 o'clock you have 6 staff members in reception. Then briefly someone comes to help out and then leaves again, and briefly someone comes to help out again and then leaves again, and you're back down to 6, and then at 9 o'clock you're down to 5, and then you go down to 4 as someone leaves, comes back, 5, 4 again, someone leaves, they're down to 3, they're back up to 4, down to 3, back up to 4 again, stay at 4, down to 3, up to 4, down to 3, down to 2, 1, 2 there at a time, then 1, and then they're all gone. Okay, and probably when the service point closes. So that's the staff. That's the arrival pattern of the staff, the arrival and the staying pattern of the staff. And here's the patients arriving and then staying, waiting to be seen. And here we can see now the patients start. The blue is when the patients are getting a service. And so you can see at 7 o'clock they start with a bang and they start attending to patients. And the blue here, and although there's initially 2, 3, then rapidly 6 staff, you can see they're attending to up to between about 10 patients there and then about 17, 18 patients there. And this is because they attend to more patients at a time as they take batches of folders and go and pull out batches of patient cards and then go and collect their folders. So you can see they're super efficient in doing that, and they rapidly bring down the mountain such that by 12 o'clock the mountain of patients has been more or less attended to, with a huge burst of extra efficiency around about 11 to finally get that hump down. Okay, so as the patients get seen, the red decreases as the blue increases here. Of course, as patients get seen, other patients are arriving, as we saw here with the arrival graph, so the numbers don't come down as rapidly as one would expect. So although they're seen patients here, the numbers who are waiting to be seen are still rising, even though they are seen patients, because more patients are arriving than are being seen. Then later they reach the equilibrium point, and then they start seeing more patients than those who arrive, and we know that less patients arrived later in the morning, which then gives them, eventually they manage to catch up. Okay, so how do we determine causes of waiting time from this graph? Well, what we see here then is patients arriving long before the staff. So if you arrive at 4 o'clock and the staff only get there at 7, then you are guaranteed to wait 3 hours, i.e. from 4 o'clock to 7 o'clock before you get attended to, because there's simply no one there to attend to you because the service point hasn't opened yet. So this would be a mismatch then between patients arriving and the service point being available, and this will result in a large waiting time. And this can be seen on the arrival time graph, that those who came early in the morning waited on median extremely long time before they finally got attended to. Okay, so that's the mismatch. Now, are there other causes of patients waiting long time? Yes, there could be inefficiency in prioritizing patients. That means staff are present, patients are present, but the staff don't attend to the patient. They do other things. So is that cause operative here? And here you can see that there are patients waiting from the afternoon onwards. There are staff present in reception, and yet for several periods of time they don't attend to patients. So here after 12 o'clock for 10 minutes they see no patients, then for 5 minutes they see no patients, then they see one patient, even though there are 3 or 4 staff present at the service point. Then after one, there's 20 minutes in which they see no patients, then see one of them, then another 20 minutes, no patients, then see one, then 15 minutes, no patients, then attend to them, and then throughout this time then again. There are patients waiting, there are staff present, but the staff choose not to attend to the patients as they do other things. Okay, and of course this results in patients waiting quite a bit. So if you look back at the arrival time graph, you can see here not as bad as those who came in the morning, but the median waiting time starting to rise in the afternoon again, after it come down quite substantially from the morning. And then our last cause is flow problems. This means staff are waiting and patients are held up elsewhere. Now this you would see staff present, and then instead of seeing red or blue here, you would see a white out, which would mean that patients are being held up elsewhere. And so there are no flow problems here at this service point. So putting it all together then, why was there a high median waiting time at the reception? So one, there was batching in the morning, as seen here, batching in the morning, which major cause of high waiting times. Two, there was a mismatch in the morning, the other major cause of the high waiting time. Okay. And those two causes together essentially account for almost all the waiting time at this service point. However, there were also other causes of high waiting time, and that was inefficiency in the afternoon, after the staff had been incredibly efficient in the morning, However, no matter how efficient they were, they could not make up for that mismatch or that batching. So no matter how efficient you are, if there's batching and mismatch, patients are going to wait long. Okay. However, this efficiency didn't last. It was great through the morning, but in the afternoon they seem to have run out of steam and the efficiency levels are quite low, resulting in the patients waiting. And then there was a queuing problem, which affected a small number of patients at certain periods of time in the day. Okay, but a small number of patients affected by the queuing problem. Okay, so now you know the causes of the high waiting time at reception, which is mainly batching and mismatch. So now you can address it. So how would you address batching, or cause number one? Clearly, if you provide appointments for the patients, then they won't batch. And you must obviously provide appointments for the late morning and early afternoon. It would be no point in giving appointments for the morning, because if you gave appointments for 7, 8 or 9 in the morning, all you would do is make the batching worse. And you want to give appointments for later in the day when hardly any patients arrive. Because as you can see here, 90% of the patients who are going to be attended to at this facility have in fact arrived by 9 o'clock. And only 10% arrive after 9. So that makes a massive problem with batching and mismatch. And in fact, if appointments were given, this blue here they gave appointments for later in the day, then would be. And it's not helpful that you gave appointment for no specific time, because then the patients would tend to come early in the morning as well. But given appointments, it provides for some of the patients, but not for those who don't have an appointment. So there were a large number of patients who had no appointment. Okay? Hence for them, you would want to encourage those who don't have appointments to arrive later in the day. And after 10 would be a safe time for the service point, resulting in them waiting far less than they do coming early in the morning. The other thing, patients, there was a mismatch. Patients arrived early in the morning, very early in the morning. So why do they do that? One, they believe they have to for some reason, and two, they fear they have to, because if they don't, they might get turned away. So if you don't turn away patients, then you're less likely to get this mismatch early in the morning. And if you encourage them not to come early in the morning, then again you can cut down on this mismatch. But then you'd have to apply yourself quite diligently to encouraging them to come, because once a pattern is set in, it is hard to change it. Then there was inefficiency in the afternoon. So the solution would be to improve the efficiency in the afternoon and to look at why they were inefficient in the afternoon but extremely efficient in the morning. Did they just run out of steam? Okay? And a good thing is, it is likely that in the afternoon they are putting away the folders of the patients seen in the day and perhaps preparing for the next day. However, there's several staff there, so some of them could do that and others could primarily attend to the patients, thereby cutting their waiting time. And finally, there was a small queuing problem, and this you would need to investigate and then resolve. And we'll pause there. So, we've looked at the causes of the high median waiting time, and indeed the high waiting time at the 25% and 95% cutoffs as well for reception. shown what they were, and suggested solutions to decrease them. And if these solutions are implemented, indeed the waiting time would come down dramatically. Now let's look at another service point, also at the reception service point, but here you'll notice the waiting times are rather low. So on median they wait 14 minutes, although 5% do wait 82 minutes or more. The service times look pretty good, and here's the number of staff, the number of patients, the percentage time spent attending to the patients by the staff. Here's your logistics equation. So, why do you think they have a low waiting time? Or are there causes for the high waiting time for this group of people and perhaps these? And how could we improve it to try and bring them also down to that low level? So again, same principle. Simply look at the 8 causes for a high waiting time or long waiting time and see if they apply. So these first 3, high workload, high service time, logistical problems, can be determined from the table. So, do they have a high workload? No. Do they have a high service time? No. Do they have logistical problems? No. So, none of those are causing this high waiting time here at the 5% cutoff. Note their waiting times are generally low, and so they're doing well, and any causes of high waiting time would affect a small number of patients. However, if they want to improve, decrease this number of patients waiting, they would then have to look at that. Also useful to see that if the waiting time is low, why is it low? In other words, which of those causes that could cause high waiting times are not in effect rather than being present? Do they have batches, and are there queuing problems? And that you see from the arrival time graph. Okay, and now look here. There is a small batch. There is a batch. It looks large. Look, it's going up in the air, the red line. Okay, however, it's 40 patients. It's 40 patients. So in general, that's not too much of a batch for the service point. Why is that? Because the service point on median sees a patient for 2 minutes. That means one staff member could see about 30 patients maximum in an hour. Okay, let's say 25 comfortably, 20 to 25 comfortably. Of course, if there were 2 staff, then they could see about 50 patients, 45 to 50 patients comfortably. So although that number arrived, and it's not a good idea, their waiting time shouldn't be too high because it's not too much of a batch relative to the staff there to attend to them. But you'll note also that although there isn't a large batch, there's a small batch. And why did this small batch occur? Why did this batching occur? It would have been better, even though their waiting times are not so high, it would have been better if they'd come spread out throughout the day, in which the waiting times already low, the already low waiting times would have gone even lower. Okay. And if you look at the arrival pattern here and look at the appointments, you can see that the arrival pattern mirrors the appointments, except that the patients arrive earlier than their appointments. Can you see that? So here, the 8, they arrived before, so it's left shifted, the line, the solid red line compared to the blue. Also you can see that these ones who have no appointments also come in the morning, because there's a higher number than those requiring appointments who arrive. Okay, but fortunately their waiting time's not high, the median going just above 20 here, even for those who come early in the morning in a batch. It's about 25 minutes, when throughout the day it's 14 minutes. Okay, so no batching. Now is there queuing? Yes, and look at this. Look how high the black line is. So there's clearly queuing problems. So if you put this median on that, it's way above it. Similarly, if you put that median on that, the 8 o'clock on the 7 o'clock, it's way above it. The 9 o'clock on the 8 o'clock, it's again way above. That's where it would be. The 10 on the 11, it's again way above. So certainly there are queuing problems, and those queuing problems are making a few patients wait very long, above 80, above 100, above 100, above 140 minutes. And in fact, those are the patients we see, the 5% who are waiting very long. It's mainly due to queuing, and this 25% here is due to the small batches that we're seeing in the morning. Are there other reasons for some patients, a few patients having a high waiting time and others generally waiting reasonably low, short waiting time? Well, we can look at mismatch, inefficiency and flow problems, and that we look at on the snapshot graph. And as you can see, there's a small mismatch in the morning. Patients arrive before the service point opens at 7. The staff get there, 2 of them, later another one joins for a while, then 2 are left to carry on the rest of the day. Okay, so there is a mismatch. Inefficiency, not really. They're very efficient in the morning, growing to extremely efficient later in the morning. However, in the afternoon, there are periods of inefficiency. So you see it's red there. It means patients are waiting while the staff members are present. Okay, and the staff are doing something else rather than attending to the patients. Okay, so there is some inefficiency. Flow problems, not really. Although here you see a whiteout, there's white and then the patient arrives. But in general, you don't want patients to be coming late, very much later in the day. So it's no problem to the staff here because they can get on with other things. In fact, one wonders why they don't do the other things during this time rather than when they're patients, and rather first attend to those patients and then carry on. So again, we see that there's small mismatch and a little bit of inefficiency also contributing to these small number of patients waiting a reasonably high waiting time, and a few patients waiting just longer than is necessary, although it's not too high compared to the other reception service point we've looked at. But on the whole, patients don't wait long here at the service point, and that's because the major causes are not operative. So for this service point then, we have some batching in the morning, small mismatch in the morning, some efficiency in the afternoon, although they're very efficient during the day. Okay, and the solution, and of course there was a queuing problem. So the solutions are as before: provide appointments for the late morning and early afternoon. So these appointments are a bit too early, and although it isn't causing a dramatic rise in waiting time, if they'd shifted that there, the waiting time could have been below 10 minutes for everyone. And of course, encourage those who don't have appointments to arrive after 10 as well, and don't turn patients away. Improve the efficiency in the afternoon. There's no reason why they can't. And the queuing problem, you'd have to investigate and resolve what is happening there. Why are patients queuing inappropriately and just being bypassed while others get seen? Okay, so that was quite easy. So it's quite simple. All you do is, for every service point, look to see what causes are operative. The ones that are, sort them out. So, and even for those with low waiting times, you can do that, in others, to make them even better than they are. Those with very high or long waiting times, yes indeed, you'd want to do it to substantially decrease the waiting time. So now let's look at a nurse service point. It's a consulting room of a nurse, and as you can see, the waiting times are very high. On median, they're waiting 240 minutes. That's 4 hours. And of course, 5% of them wait 465 minutes. That's more than 7 hours. So the question is, why are these patients waiting so long to be attended to by the nurse? And as before, all you do is go and look for the cause. So From the table, we can look for high workload, high service time, and logistical problems. So, is it due to a high workload? Clearly not, because the nurse spends 26% of her time attending to patients. Is it due to a high service time, an inappropriately high service time? Probably not, because patients are seen between 6 and 20 minutes, which is what one would reasonably expect for a nurse service point. So some patients are simpler, you see them in shorter time, some are more complicated, you take longer, but on median you spend 10 minutes, which seems perfectly adequate to provide a good quality service and is not inappropriately high. So then, is it due to a logistical problem? Apparently not. For the answer is no. There's no problem with space or equipment that would cause a high waiting time. So then, what is it due to? Is it due to big batches and queuing? So is batching and queuing effect? And here it looks like a high number, but that's only 4 patients, so that's not batching. Okay? And is there a queuing problem? No. See the black lines there, and if you put the median on the median, it's way above it. Similarly there again. So it's not a queuing problem. So then, what is it? Is it due to mismatch? Is it due to inefficiency? Or is there a flow problem? And we look here, and we see there's a mismatch. So patients, the service point, the staff member arrives at 7:30. But the patients arrive long before that. Some arrive in just at about 5 o'clock. So of course they're guaranteed to wait more than 2 hours for their service. And then also inefficiency. So even though the staff member arrives at 7:30 and spends most of the day working at the service point, in fact the first patient only gets seen at 9:40, causing an even longer wait. And especially since these people had already had a mismatch, now on top of that there's an inefficiency. So the nurse, instead of attending to the patients, is doing other things. Is there a flow problem? No, there isn't. You see a whiteout here, but that's at the end of the day, and that's what you want. Okay, so there's no patients and the staff members present for a short period in the day, but that's fine, and towards the end of the day you can finish up your admin duties then. You wouldn't want to see this at the beginning of the day, however. Then that would be a flow problem, because the staff would be there and no patients arriving. Okay, so we saw there was a mismatch, there was inefficiency, and indeed there appears to have been a small queuing problem. Oh yeah, there it is, at 9 o'clock. So if you take it 9 o'clock, okay, then the next time here, and you put that on it, and in fact there's a slight queuing problem. The bar goes up just for one patient. Okay, so that's it. So essentially the big problem is mismatch and inefficiency. So one, encourage patients to arrive after 10, since the nurse only starts the service at 9:30, although she's there from before. And the other one is of course improve the efficiency. And you could look into the small queuing problem, although that was a very minor issue. So now let's look at another nurse station, and here we have a relatively low waiting time for the nurse. So again, 13 minutes on median, and 5% of them wait more than half an hour. Contrast that to the previous one, where they were waiting more than 4 hours on median, and you see the huge difference there. So then why should there be low waiting times here? Okay, let's go and investigate and see. So there are your causes of the high waiting times, and let's go through all of them and see if any of them are operative even to a small degree. High workload, what do you think? Nope. Above 85% and you'd worry about the workload. Okay, between 60 to 80% is probably fine. Okay, between 50 to 85 is probably fine, depending on the type of service. Below that, below 50%, you would have extra capacity where the staff member could be utilized for other activities. Above 85, you'd worried that you're getting quite overloaded because there's nothing else you can do in the time except attend to patients. Was there a logistical problem? No. Is the service time inappropriately high? No. 7 minutes, ranging from 3 to 17. Appropriate, depending on the case mix the nurse was seeing. Okay, is there batching? Nope, no batching. In fact, nicely, here you can see patients are nicely spread out throughout the day, even though most of them did not have an appointment. So even though most of them did not have an appointment, they came reasonably spread out throughout the day. Okay. You see one queue-in problem here. One patient got the wrong end of the queue there, unfortunately. Is there a mismatch? No mismatch. Patients arrive just as the staff member does. Is there inefficiency? No inefficiency. In fact, extremely efficient. Patients are seen immediately that they arrive at the service point. Okay. So, we can see that there's low waiting times because none of the causes of the waiting times are operative, except for that minor queue-in problem at 10 o'clock, which you then have to investigate. Okay, and it only affected one patient. Okay, so there we see low waiting times, easy to maintain because none of the factors causing a high waiting time are present at this service point. Okay, so now let's have a look at pharmacy. Let's have a look at pharmacy, and here again are the causes of a high waiting time. Now you see if you are able to determine what the causes of the high waiting time are at this pharmacy. So look at the table. Which causes do you think you can see from this table, and are they operative or not? Well, what have you found? Have you discovered any of them that were? Okay, so let's look at the table together then. Clearly there's a high waiting time, on median 70 minutes. Some patients wait more than 2.5 hours to get a service at the pharmacy. Is it due to an inappropriately high service time? No. Patients on median get 3 minutes, and the range is from 1 to 9. So perhaps with one simple medication, more complex medications. So it seems appropriate for the service point. Is it due to logistical problems? Yes, they report logistical problems. Is it due to them being overworked? Absolutely. They are spending 98% of their time attending to patients. So virtually all the time they have available, they're spending on patients. So essentially they're seeing patients all the time they are there without stopping at all. So clearly overworked is the major cause here. However, there's also a logistical problem. So, looking at the graph, is there anything you can see here that might also be contributing to the high waiting times? Have a look at the graph. What can you see? So what could you see on the graph? Well, you could see batch in, if there were. Do you think there was batch in? Yes, there's certainly more patients arriving between 8 and 10 than the rest of the day. Ideally, you'd like to see a smooth line or nice little flow across at the similar level. But it's not too bad, as these patients are still coming throughout the day, except later in the day, which is also fine because you have to close at some point. Okay, so there could be little bits of batch in here, but not that much. However, they could be shifted across. But note in here, you'll see that there are appointments being given throughout the day, but most of the appointments are still in the morning, which is probably causing that little bit of batching. Because yeah, even though you see here, there's lots of patients who have no appointments at all, and they probably also come in earlier in the morning, although there's a nice spread. And there's a nice spread because they give appointments throughout the day. However, they start their appointments at 7, which is not a good idea since there are people coming early in the morning. Would be better if they had started their appointments at 11 in this case. In which case the red would have come down here and the red goes up here, so they would be spread out throughout the day, decreasing their waiting time. Second thing you can see on this graph is queuing. Is there a queuing problem? Yes, indeed. At 8 o'clock and 9 o'clock there are queuing problems, but not the rest of the day really. So this is probably a minor problem, as is the small batching a minor problem. So on this graph, what causes of high waiting time could you see on this graph, and are they present or not? So have a look, see what you think. Well, so what have you come up with? Or what things can you see on the graph? So you could see mismatch, you could see inefficiency, and you could see flow problems. So was there a mismatch? Yes, indeed. There was a small mismatch in the morning, where patients came before the service point opened. You can see the service point opened at 7:10, but patients would come in from 5:30 onwards, although small numbers of them. But still, that gave them a relatively long wait. Then, is there inefficiency? Were they leaving patients to wait while they do other things? Absolutely not. In fact, there's huge and massive efficiency. Extremely efficient. And as you can see, there are 3 staff most of the day, 4 for some of the day, and they're pulling up folders in batches and attending to up to 20 patients at a time, and then more than 20 patients at a time, by doing the folders in batches in order to get to clear this mountain of patients who are present throughout the day. So they, as efficient as they could be, it's hard to imagine them being any more efficient than this. And yet they still don't manage to clear this mountain of patients until 4 o'clock in the afternoon. And note, when they start in the morning, they start with 35 patients already. And they continue, and they never decrease this 35. This then rises throughout the day as more patients come, and they're just too few staff to cope with the load, and only at 3:30 do they finally get down to 35 again, and at 4 o'clock they start clearing all the patients. So a sterling effort, but they're just too overworked to actually reduce the waiting times. Okay, so the causes of the waiting time is a high workload, there's a logistical problem they reported, and there's a small bit of batching in the morning, small queuing, and small mismatch. So a high workload being the major cause of the high waiting time here, with the others contributing, pushing the waiting time even higher than would be if it was just the high workload. So clearly, the solution to the high workload is to provide more staff. If that's not possible for whatever reason, then the second best option is to remove some of the patients, and this could be done by outsourcing the services in various ways. This would of course be second best. It would be better to increase the staff so they can manage the workload. So if there's a logistical problem, it needs to be investigated as to what it is. Is it equipment or space? And then resolved. Batching in the morning, indeed, they could give that. As we saw, they were given appointments for too early in the day. If these are shifted, then the batching will decrease, and that will be a slight relief from the waiting times, but that's not the major cause. Okay, you can investigate and resolve the queuing problem. Okay, and of course for the mismatch, we can encourage those who don't have appointments to arrive in the afternoon, and of course don't turn patients away. Okay, so now here we have a relatively low waiting time for pharmacy. And why do you think that is the case? Have a look at this and see what you think. So yes, as you can see, the waiting time on median is now 8 minutes. Compare that to the other pharmacy where it was 70 minutes and over 2 hours for some. Here it is 8 minutes. However, it is more than an hour and a quarter for a small number, and you'd want to look at why that is the case. And you'd want to see how they are managing to keep their waiting times low when their colleagues couldn't do that. So what do you think it is? Well, clearly there's a logistical problem, and there's a problem with the computer and the label printer. So if there's difficulty printing labels for the medication, obviously that would cause the patients to wait a bit, and that might be that causing for some of the patients to wait, where at times there's a problem. The service times seem appropriate for the service point, they're not too high. The workload, they're clearly not overworked. Okay, all resulting in a low waiting time. Okay, so there's your causes, and you're looking at it. And is there batching? Not a small bit of batching there. Okay, but those are 25 patients. However, you can see again that small batching was caused by giving appointments again for 8 and 9 o'clock, when these were better given for. See here they gave a few for 11 and 12. These could have been given 11, 12, 1 and 2, pushing these, the red line, up higher here and decreasing the red line over here. Okay, we can see the queuing problem. Note the queuing problem there. And here, any problems here that you can see? And yes, you see a small amount of mismatch, but it's just one patient. And then you see a period of inefficiency. A period of inefficiency. And if you look back, you'd see the waiting time rose during that period, and that is due to inefficiency. So a few patients waited very long, and that appears to be queuing problems and inefficiency problems, a short period of inefficiency. Okay, the batching here, you can see it's small and didn't have much effect on the waiting time. However, they could have smoothed it out by getting them to come later, because the batching is caused by the appointments. Although it hasn't had a massive effect on waiting time, it has some effect. And so the waiting time here could be cut down to 5 minutes if they're given appointments for later. And of course here could be reduced if they weren't inefficient in the afternoon, and if they solve the queuing problem. Okay, so there we go. There's a logistical, queuing, small mismatch, and inefficiency for a short period. And then the solutions are, again, as before, resolve the logistical and queuing problem. Number 2 should say queuing problem, not logistical. It's covered in 1 already. For the mismatch, encourage them to come later, don't turn the patients away. And for the inefficiency, They should rather prioritize the patients and then do the other things when there are no patients around. Okay, and now you're becoming masters at this. It's all relatively easy, isn't it? Okay, and so here you have TB dots. What did you think of the waiting time here, and what do you think is causing the issues with the waiting time, whether it's high or not? So you're having a look to see, do you think? Okay, so are the waiting times high? And remember, waiting times are relative to the service points as well. Has been an absolute for every service point. So what is the key thing about TB dots? What does that mean? It means that patients come to receive medication almost every day of the week, or almost every day of the week, certainly the Monday to Friday. And so they come in there regularly, the same people, and they're just collecting their medication. So it's clear you do not want to keep them waiting. Their wait should clearly be kept to an absolute minimum, under 5 minutes. And yet here we have patients waiting on median 42 minutes, and some of them waiting almost 2 hours just to receive their daily medication. Now this was indeed quite a big problem with waiting times, okay, and it's perhaps worse than others who wait a longer time but come for a different service, such as seeing the nurse or the doctor. Okay, is the service time high? No, it's appropriate for patients who come regularly just to take the medication, with some of them might having a problem on their day and then the staff spend more time with them. Is it due to a logistical problem? No, there appears to be no logistical problem. Is it due to them being overloaded, overworked? Absolutely not. Okay? In fact, they spend only 8% of their time attending to patients, which means there's a large amount of spare capacity. So these staff are available to do other things for 92% of their time. So, high waiting times, cause thus far unknown. Any problems here? Are there batching? Yes, there's a little bit of batching in the morning, not too bad though, just under 30 patients arriving, but it is early in the morning. Queuing problem? Yes, 10 o'clock, 11 o'clock, and even 1 o'clock is a little bit of a queuing problem. And on this graph, anything you can see that might be causing the high waiting times? Is there a mismatch? No, no mismatch. Okay, no patients arrive before the staff. Is there inefficiency? Yes, considerable inefficiency. Now here is an example of both absolute and relative inefficiency. So here you can see between 7 and 8 there are patients there waiting to be seen, and the staff don't see them, even though the staff are there. But between 8 and 11, although you see blue here indicating that patients are being attended to, this is still relative inefficiency, because there are 4 staff present most of the time, 3 at some point. However, they never see more than 1 patient at a time, reading off here. So if there are 4 staff, then 4 patients could be seen at the time, and the blue line should be about here. So in fact, there's inefficiency throughout the day, with sometimes there being absolute inefficiency and other times relative inefficiency, as staff do other things, or as the many staff present at the service point do other things rather than attending to the patients, causing the patients to wait for quite a long while, with a median waiting time of 42 minutes. Okay, So we found the cause of the high waiting time here for the TB dots, and that is due mainly to inefficiency, partly to a little queuing and a small batching problem in the morning. Okay, now we look here, and what do you think of the waiting time at this TB dot room? And you should have spotted it right away that there is a low waiting time for almost all the patients. 75% of the patients wait less than 8 minutes, although 5% wait about 40 minutes or more. So this is a problem, especially noting that this is a service point where you don't want anyone to wait. If you want them to come regularly and take their medication, you certainly don't want to keep them waiting, because what happens here is indeed an average day, and so on average people who come every day have to wait every day. So what is the cause? So why is it the waiting time low for most of the patients and high for a few? Okay, is it due to a high workload? Nope. Is it due to a high service time? No. Is it due to a logistics problem? No. Is it due to batching? A little bit, perhaps at 9 o'clock, where just about 30 patients come. Okay, but not too severe. Is a spread of patients throughout the day. Is it due to queuing? Indeed, it is due to queuing. So there's a queuing problem here, and a small bit of batching. And here, anything you can see on the snapshot graph to indicate why there should be a high waiting time for a small percentage of the patients? Not really. There's no mismatch. They're very efficient. There's no inefficiency. Which means then that it's the small batching here, although that's not having much of an effect, because you see your waiting time is 5 minutes. So in fact it is queuing which is causing the problem for that 5%. 5% of patients, the problem for them is a queuing one, causing a few to wait relatively long compared to the other patients waiting a reasonably short time, which would be appropriate for the service point. Okay, so now taking it with the doctor, how would you determine what is happening here and what is causing it to happen? So now you should be pretty quick at this, and it should be clear and obvious. So you can see the waiting time is very high, on median more than 2 hours, more than 2.25 hours in fact, and some of them wait for more than 4 hours, for more than 4.5 hours. The causes of it, is it due to them being overworked? Not really. Is it due to high service time? No. And is it due to logistics? Yes. There appears to be a logistical problem. Is it due to batching? Yes. There's a bit of batching at 8 and then again at 10. Is it due to queuing problem? Nope. Put the median over there on top of that, it will go above the black T bar there. Okay, so it's not due to a queuing problem. There is a bit of a batching problem there, although they are spread out, although none in the afternoon. Okay, very little arriving in the afternoon. And then, is it due to a mismatch? No. Is it due to inefficiency? Yes, it's due to inefficiency to begin with. Okay, but then thereafter they become relatively efficient throughout the day. Little bits of inefficiency for short periods of time. So, the causes of the waiting time then were that there's a logistical problem causing the waiting time, and there's a bit of batching in the morning, and the combination of those two is causing the waiting time to go up. So now let's look at this one for the doctor, and what do you immediately spot? Yes, you should be getting this quite easily now. So what do you find is that for relatively low median waiting time, so half the patients wait very little. However, a quarter of the patients wait quite long, and 5% wait very long. So what's causing this? And yes, there it is, a logistical problem. Is it due to a high service time? No. In fact, the service time is a bit on the low side for the doctor, depending on the case mix. Is it due to being overloaded? Definitely not. Is it due to batching throughout the day? And not really. Not really. Is there a queuing problem? And indeed, there is a queuing problem. There's a small bit of a queuing problem there. Okay. And not really batching, because that's only 6 patients arriving there on the spike. Okay. And then, so what is causing that small number of patients to wait very long? And we see here it's due to a mismatch, and of course due to inefficiency. So a mismatch and inefficiency is causing a small number of patients to wait very long, but generally patients do not wait long at all. However, quarter do, and that quarter is due to mismatch and inefficiency. Okay, so now you can go through every single service point like that. Assess whether the waiting time is high or not, and if the waiting time is high, then look at what is causing the waiting time to be high at that service point, and then look at ways to modify that via recommendations to improve, to remove those causes. So really simple stuff, easy to do. Okay, and just some operational issues when conducting a waiting time. Okay, note that the staff are the main data collectors, which is a good thing. In one, engaging staff in the actual measurement, and two, it keeps the costs down because the staff are already there, and it's easy to use the staff because they really spend less than 10 seconds per patient collecting the data. And of course the drawback is that if you're using all the staff need to be aware of the survey, and they need to have been explained what it is they have to do, and hence you need some preparation beforehand. Now note, the survey can only work if the staff are actively involved. Okay, it cannot be run properly without involvement of all the staff. This is obviously because the staff must fill in the correct time, and if they don't fill in the time, then the problem is that your analysis will be all skewed. So if a staff member doesn't fill in the time that they sent attending to the patient, then it would appear as if the next staff member who sees the patient had an extremely long waiting time, when in fact not, because the time had been spent on waiting for and receiving a service at the previous service point and not at the one thereafter, or not necessarily. There's some tricky bits. Some service points are complicated, and if you're actually doing the survey, then the data collection form needs to be customized, and you must test it beforehand to see that it works, it fits the way in which people work at the service points. Obviously some staff might be anxious. Okay, they might fear that it's an individual checkup on them rather than a systems assessment, and they would need to be reassured about that. As you can see from the results, staff members are not individually assessed. It's a group thing, and it's not to assess who's to blame. It's assess the way the survey determines what the problems are, and then looking at how to resolve it with the staff. Okay, so clearly you need good communication. And then of course you need field workers to do the arrival and departure time. But note, during the day the field workers will, when they see the forms, they might spot mistakes that the staff made in completing the forms, and it might then be an issue if they need to explain to the staff how to do it properly, because the staff with the health service being a highly skilled workforce, they're likely to be far more educated and have greater power than the field workers, and it might be actually quite difficult for field workers to point out errors to people who are much more educated than they are. Okay, so the requirements for running a sustainable waiting time survey. You obviously need a budget, although it's very cheap. All you need to do is print the forms and pay the field workers. Then you enter the data in a database that is already available, so there's no cost there. The cost is just the time in entering the data. Okay, the survey methodology is clearly robust and it's standardized, which means that because it's robust and standardized, anyone can do it, and also you can repeat it over periods of time to assess what effect any interventions you have done have had on the waiting time, and hopefully they will have reduced it. Okay, the database performs the analysis and produce routinized reports, so all the graphs and the tables you saw, they came in an automated way from the actual database, so the database produced them. Okay, so clearly the benefits of the survey exceed the costs. Okay, and probably if you're running a survey, you would need some support from someone, a researcher or someone who's done surveys of this nature before. One thing is not available is that the health staff trained to run the survey. So if you're running it at facility, someone must take the lead in running the survey, and that might be the facility manager or some staff at the facility, and clearly they would then have to be trained to do that, unless some external group comes in and does it for them. Okay, thank you. We've come to the end of the video. We hope we've shown you how to conduct and interpret waiting time surveys.